Have you ever wondered how doctors test for certain infections, like syphilis? Meet the VDRL test, one of the most trusted methods to screen for this condition. The VDRL test, or a venereal disease research laboratory test, is a simple blood test. It checks for antibodies produced in response to Treponema pallidum, the bacteria responsible for syphilis. Now, what is syphilis? Syphilis is a sexually transmitted infection caused by a bacterium called Treponema pallidum. If left untreated, it can lead to serious health complications. It progresses in stages: primary, secondary, and tertiary. In primary, there are sores on body and which can be healed by body itself. In secondary, there are sores and body rashes which also get healed, but in tertiary, body organs are involved, so the cure is not possible by itself. Let's discuss about culprit behind syphilis. Treponema pallidum is a spiral-shaped bacterium that spreads through direct contact with syphilis sores during sexual activity or from mother to baby during pregnancy. How does VDRL test works? Let's discuss it. Here the procedure for test. First of all, the patient's serum is inactivated by heating at 56 oC for 30 minutes in a water bath to remove nonspecific inhibitors, such as complement. VDRL antigen suspension. Colloidal suspension of 0.3%, cardiolipids 0.9% of cholesterol and sufficient lecithin. Controls and samples are brought to room temperature. Using a mixing stick, the test specimen and the VDRL reagent is mixed such that it thoroughly spreads uniformly over the entire reaction circle. The slide gently rotated and continuously, either manually or on a mechanical rotor at 180 revolutions per minute. Flocculation is checked microscopically using 10x objective and eyepiece at about 8 minutes. Here a result demonstration. A positive VDRL test is indicated when the presence of antigen-antibody clumps in the center or the periphery of the test circle. A negative VDRL test is indicated when absence of antigen-antibody clumps, indicated by a smooth, even light gray appearance with no aggregates. All reactive and weakly reactive serum requires serial dilution to estimate antibody titer. The titer is reported as the reciprocal of the highest dilution, which shows a positive test result. Limitations of the VDRL test include that VDRL test can sometimes give false positives due to other conditions, and confirmatory tests like the DPHA and FTA antibodies detection tests are often needed. Confirmatory tests for Treponema pallidum includes direct microscopy and DPHA test. Indirect microscopy. Dark field microscopy is done to confirm Treponema pallidum. This is the oldest and simplest but very reliable method. In this method, specimen is collected from lesions and visualized direct under microscope. No direct light passes onto slide. Instead, diffracted light shows bright image of DPHA test. Acronyms for Treponema pallidum. Hemagglutination test is a blood test that detects syphilis by looking for antibodies against the bacteria that causes the disease. Early detection and treatment of syphilis with antibiotics can prevent complications, and penicillin G, administered parenterally, is the preferred drug for treating patients in all stages of syphilis. The dosage and length of treatment depend on the stage and clinical manifestations of the disease. In summary, syphilis is caused by Treponema pallidum. The VDRL test is a vital screening tool for early diagnosis. I hope this was an informative video and you all would have liked it. Stay informed and proactive about your health. For more information, consult your healthcare provider. Thank you for watching. Don't forget to like and share the video.